It's 7:42 a.m. A man stands at his kitchen counter, coffee in hand, mid-sentence, and suddenly his words melt. The mug drops, his right arm won't move. His wife stares for half a second, unsure if it's a joke. It's not. This is how a stroke begins, quietly, brutally, and without warning. In the next 3 hours, every second will decide how much of his brain survives, or doesn't. Imagine 2 million brain cells dying every minute. By the time an ambulance arrives, millions more are gone. Speech, memory, movement, erased like files on a crashing hard drive. But here's the thing, it doesn't have to end that way. Because there is a way to fight back, a clear, fast protocol that can turn a tragedy into survival. But to use it, you have to spot the signs early and act instantly. Next, we'll break down exactly what a stroke really is and how one type can be reversed if you move fast enough. What a stroke really is, it's not a heart problem, it's a brain attack. When blood stops flowing to part of your brain, oxygen disappears, and brain cells start to die within minutes. That's the brutal simplicity of a stroke. There are two main kinds. The first, ischemic stroke, is like a traffic jam in your brain's highways. A clot blocks the road and blood can't pass through. The second, hemorrhagic stroke, is when a vessel bursts, flooding the brain with pressure instead of oxygen. Different causes, same outcome, a piece of you goes dark. It doesn't always look dramatic. Sometimes it's a drooping smile, sometimes a slurred word or a lazy arm. But inside, your brain is screaming for help, silently, and every second counts. So how fast does this countdown really move? In the next part, we'll zoom inside the brain to see what happens minute by minute when that blood flow stops. When that blood flow stops, chaos begins. In the first minute, brain cells panic. They run out of oxygen, energy crashes, and tiny electrical sparks, the ones that make you move, talk, or think, start to flicker out. By the 5th minute, the damage spreads like a blackout in a power grid. Neurons near the clot suffocate first. Others nearby fight to survive, relying on whatever backup blood vessels they can get. But even those reserves fade fast. At 15 minutes, your brain starts losing control of the body. An arm droops, speech slurs, a blank stare replaces understanding. To the outside world, it looks mild. Inside, millions of neurons are dying in silence. This is the silent countdown doctors fear most, but there's a silver lining. There's still a golden window when quick action can save almost everything. The question is, how long is that window really open? How long is that window really open? Roughly 3 hours. That's your shot, your brain's last chance to fight back. Doctors call it the golden window because within it, a powerful clot-busting drug called TPA can reopen blocked arteries and restore oxygen before too much damage sets in. But once those 3 hours pass, the brain's chemistry changes. Dead tissue forms, the clot hardens, and even the best medicine can't reverse what's already lost. That's why time is brain isn't just a slogan, it's a literal truth. Think of it this way, for every minute you wait, the brain loses about 1.9 million neurons. That's more than what most people use to read, walk, and talk combined. So how do you spot a stroke fast enough to save those minutes? The answer fits in 4 letters, a simple code that could save someone's life, FAST. Next, we'll break down what each letter means and how to use it when seconds matter most. When seconds matter most, remember FAST. It's your emergency checklist for a stroke. F, face. Ask the person to smile. One side droops, that's a red flag. A, arm. Have them raise both arms. If one drifts down, the brain might not be sending full signals. S, speech. Ask them to say a simple sentence like the sky is blue. Slurred, strange, or missing words. Trouble. T, time. Call emergency services immediately. Don't wait. Don't Google. Don't drive them yourself unless help is unreachable. The FAST test isn't medical jargon, it's life-saving speed. It turns confusion into clear action. Many survivors are alive today because someone around them remembered those 4 letters. But how does this play out in real life, when panic and doubt hit at the same time? Let's walk through one moment that shows exactly why acting fast makes all the difference. Why acting fast makes all the difference. Meet Maria, a nurse off duty, making breakfast for her husband David. He jokes mid-sentence, but his words come out tangled. One corner of his mouth droops. His spoon slips from his hand. Maria freezes. Half of her wants to believe it's nothing, maybe just fatigue. But the nurse in her remembers FAST. She asks him to smile. One side stays still. She says, "Raise your arms." The right one sinks. Her heart pounds. The clock reads 7:45 a.m. She dials emergency immediately. No second guessing, no waiting. While she checks his breathing, she tells the dispatcher, possible stroke, 52-year-old male, speech slurred, right arm weak. By the time paramedics arrive, it's been 11 minutes. They rush him in. Every second she saved becomes brain tissue preserved. Maybe words, maybe movement, maybe memories. But not everyone reacts like Maria. Many lose time to hesitation, and that delay can be deadly. Let's see what not to do when stroke signs appear. What not to do when stroke signs appear. Too often people wait, thinking it'll wear off, or it's just stress. They call family instead of an ambulance. Some even take a nap, hoping they'll feel better later. But while they wait, their brain is losing millions of neurons each minute. Driving yourself or delaying that emergency call can cost everything. A clot can grow, a bleed can spread, and by the time you finally reach the hospital, the golden window may have slammed shut. Others waste time on Google or home remedies, drinking water, taking aspirin without knowing the cause. But if it's a brain bleed, aspirin can make it worse. Stroke is not a wait-and-see situation. It's a drop everything and act emergency. Still, there's hope once you make that call. Inside the ER, a team is already preparing for your arrival. They don't waste a heartbeat. They launch into a system called Code Stroke. A hospital's version of a pit crew for the brain. The moment the call comes in, nurses, neurologists, and radiologists move in sync. The patient is rushed through triage, hooked to monitors, blood drawn, IV lines ready. Within minutes, the first stop, CT scan. It's not to confirm the stroke, it's to find out which kind. Is it a clot that can be dissolved or a bleed that needs pressure control? That single image decides the next move. Doctors measure blood pressure, oxygen, and glucose, anything that could worsen brain injury. Every step is timed. The goal is door to needle in under 60 minutes. That means from hospital arrival to TPA injection, the clock can't stop ticking. It's intense, precise, and sometimes chaotic, but it's also hope in motion, because what happens in this next phase can mean full recovery or lifelong disability. So, what treatments actually save a brain on the brink? Let's see how they work. For an ischemic stroke, the kind caused by a blood clot, doctors often use a drug called TPA, short for tissue plasminogen activator. It's like a chemical drain cleaner for your arteries, breaking apart the clot so blood can flow again. When given within that golden 3-hour window, it can mean the difference between walking out of the hospital or never speaking again. For larger clots, there's a newer weapon, mechanical thrombectomy. A thin wire is threaded up through the groin or wrist all the way into the brain. There, doctors use a tiny cage-like device to grab the clot and pull it out, literally removing the blockage from the inside. Both treatments are miracles of modern medicine, but they only work if the patient gets there in time. No scan, no drug, no surgery can help if too many neurons have already died. So why do so many people still miss that window, even when the signs are clear? Because denial is powerful. Most people don't want to believe something that serious is happening. They say, it's probably just fatigue, or I'll wait a few minutes. But those few minutes can erase years of independence. Sometimes it's logistics, living far from a hospital, or in rural areas where ambulances take longer. Other times, it's fear, not wanting to make a scene or bother emergency services. But stroke doesn't wait for permission. Then there's confusion. People think pain must come with danger, but strokes are often painless. A drooping face or strange speech doesn't hurt, so it's easy to dismiss. That's why awareness matters more than fear. And when the system fails, when people arrive too late, doctors can only limit damage, not reverse it. But the difference between partial recovery and permanent loss is still massive. Let's see what life looks like after the window closes. After the window closes, reality sets in. Some survivors wake up unable to move one side of their body. Others can't form words, even though they know exactly what they want to say. Everyday things, buttoning a shirt, brushing teeth, signing your name, become uphill battles. The numbers are harsh. About 1 in 3 stroke survivors struggle with long-term disability. Many need help walking. Some never regain full speech or coordination. But here's the hopeful part. Those who got treatment quickly often recover almost completely. Early action doesn't just save life, it saves quality of life. The difference between recognizing fast and ignoring it could be the difference between independence and lifelong care. But what if you could lower your risk before a stroke ever happens? The power to prevent one is closer than most people think. Let's break down the habits that protect your brain every single day. Protect your brain every single day. The biggest secret? Most strokes don't come out of nowhere. They build up silently through everyday habits. The same things that hurt your heart also hurt your brain. Start with blood pressure, the #1 risk factor. Keep it in check through regular checks, less salt, and steady movement. Then manage diabetes and cholesterol. High sugar and sticky fat clog vessels like slow cement. Quit smoking. Nicotine damages vessel walls and thickens your blood. And remember, alcohol in moderation, or not at all, keeps pressure stable. Finally, feed your brain. Fruits, veggies, omega-3s, and plenty of water. Sleep enough, move often, and stress less. You can't control genetics, but you can control your choices. Each small shift makes your arteries smoother, your blood thinner, your brain stronger. Still, not every odd symptom is a stroke, and that's where confusion sets in. Let's clear up what looks like a stroke but isn't. What looks like a stroke but isn't. Some conditions can trick even smart people into guessing wrong. Migraine aura, for example, can cause temporary vision loss or slurred speech. Seizures may leave a person weak afterward, what doctors call Todd's paralysis. Even fainting or low blood sugar can mimic a stroke's sudden collapse. The difference: strokes don't usually come and go. Their symptoms stay, often growing worse minute by minute. That's your clue. If you're unsure, assume stroke until proven otherwise. It's always safer to be wrong than too late. Then there are the myths. You can sleep it off. Give them aspirin right away. If they can move, it's not serious. All false and all dangerous. The only right move is a hospital scan, because that's the only way to tell a clot from a bleed. Now that we've cleared the myths, it's time for something brighter. What recovery can look like when hope and science work together. When hope and science work together. Recovery from a stroke isn't just luck, it's the brain's hidden power to rebuild itself. This process is called neuroplasticity, your brain's ability to rewire, reroute, and relearn. Meet David again from our earlier story. Weeks after his stroke, his speech was slow and his right hand stiff. But through therapy, daily speech drills, hand exercises, and persistence, new brain pathways began taking over old ones. It's not magic, it's biology. The brain adapts when given time, effort, and the right guidance. Physical therapists train movement. Speech therapists rebuild language. Occupational therapists teach independence again, brushing teeth, buttoning shirts, reclaiming dignity one motion at a time. Recovery takes months, sometimes years, but progress is possible. Every neuron that reconnects is a victory, and the earlier the treatment, the more brain there is left to heal. Now, let's close with what you can do today. The single action that could save your brain or someone else's. That could save your brain or someone else's. The next time you see a face droop, an arm fall, or speech twist into nonsense, don't hesitate. Remember, fast. Face, arm, speech, time. 4 simple checks, 1 life-saving response. Call emergency services immediately. Every minute counts, every second saves brain. You don't need to be a doctor to act, just someone who recognizes the signs and refuses to wait. Share this knowledge with your family, your friends, your coworkers. Post it, talk about it, keep it fresh in your mind. Because stroke doesn't warn you before it strikes, but awareness can warn you before it wins. Your brain runs your story. Protect it like your life depends on it, because it does. In the end, stroke isn't just a medical crisis, it's a race, and the finish line is reached by those who move fast.